Thank you for joining Cancer Support Community Atlanta for pain management and the latest on CBD oil, facilitated by Dr. Jada Reese with Northside Spine and Pain Specialist. If this is your first time participating in a Cancer Support Community Atlanta program, we invite you to visit our website and complete a new attendee form to stay connected to all future programs.
My name is Dr. Jada Reese, and I practice at Northside Spine and Pain. I have a special interest in cannabinoid science. It's something that's close and near and dear to my heart because I learned more about cannabinoids as I went on a medical journey with my son. And during that journey, I realized that there was a deficiency in talking about the benefits and understand the science behind cannabinoids. So I wanted to be able to be an avenue or a way to provide education to patients as well as colleagues regarding the benefits of cannabinoids and kind of destigmatize the plant itself. So in this presentation, we'll talk a little bit about the history of just cannabinoids and the hemp plant in general, cultural views regarding it, some get a little bit into the chemistry and the pharmacology. I really sometimes go off the deep end when it comes to that because I feel that if you understand the pharmacology and the science behind CBD oil and the benefits from the cannabis plant, you'll actually be able to understand why it works in so many different arenas. We'll touch a little bit about the research, the medical uses, the safety profile, and the potential interactions and how to select products. So in talking about the history of the hemp plant, it dates back as far as 10,000 years ago. And it was naturally grown in our environment, and it was a natural resource for a lot of people that cultivated as well as in the environment because of the benefits it had in proteins, fatty acids, as well as vitamins. It was the THC molecule and CBD molecule was first identified and isolated by an Israeli scientist, Raphael Musculum, in the 1960s. In the 1980s, there was basically during the Ronald Reagan administration, there was a Say No to Drugs type of campaign out. And during that time, a lot of people like from the 60s used cannabis, and they were trying to kind of outlaw or ban cannabis. And so they basically, Ronald Reagan poured a lot of research into trying to figure out the detrimental effects that cannabis had to the brain. And in actuality, during that study, they actually found and discovered the endocannabinoid system, and ended up subsidizing a lot of clinical studies or small case studies regarding the endocannabinoid system. And in 2014, that's when the Obama administration actually implemented the Farm Act bill, which allowed research of the industrial hemp plant with a tie with research institutions. And then that brought a gateway for CBD oil to be introduced into the marketplace. And in 2018, they actually revised the Farm Act bill and took CBD oil or oil derived from the hemp plant off as a Schedule 1 drug, which is important because that's what has limited a lot of the research when it comes to the hemp plant, which I'll discuss. In 2014, the American Medical Association actually did a study, and they found that they found a direct correlation between states that actually instituted a medicinal cannabis program with a 25% reduction in the rate of opioid deaths. And they also examined the amount of prescriptions that for opioids, and there was a significant reduction, especially in the Medicare population. So now I would like to talk a little bit about actually what CBD is on a molecular level. CBD is one of 113 it may be even more, like 140 cannabinoids identified in the cannabis plant. It accounts for about 40% of the extract from the cannabis plant. And they're doing research and showing, the preliminary research is showing benefit in anxiety disorders, cognition, movement disorders such as Parkinson's, pain, but they are not finding the high quality evidence in the US. It's in Europe and Israel, because again, in 2018 is when they actually took the hemp plant, by federal definitions, 0.3% or less of delta THC-9. They took it off the controlled substance drug list. Prior to that, the University of Mississippi was the only institution that had the research license to actually research the cannabis plant, and they were kind of the directors in who they would actually do research in combination with. There were some studies in California and other places where they did, extend the ability for them to research the cannabis plant. But the reason that there has been limited research is because in the US is because of that, it being a part, considered a controlled substance. Now, in looking at the endocannabinoid system, they believe that it's one of the most important discoveries in human physiology. Research is revealing that if you can control and maintain the endocannabinoid system, you can help your body to achieve homeostasis. And because it was such an important part of our diet back 10,000 years ago and kind of got taken or being extinct out of our diet, they believe that certain treatment-resistant conditions are a result of cannabinoid deficiency. And they believe that by supplementing the body with these cannabinoids, that you're able to maintain optimal health or achieve homeostasis with the endocannabinoid system. Now, I did want to touch a little bit about the different receptors. The cannabinoid receptors, CBD1 receptors, are located in the brain and in the spinal cord, and CBD2 receptors are located throughout the rest of the body in what we call the peripheral nervous system, which it can be found in the gut, in the skin tissue, in the musculoskeletal tissue, and throughout. The cartoon actually shows a little bit about where the CBD1 receptors are located, which primarily in the brain and then the spinal cord, and then the CBD2 receptors located throughout the peripheral nervous system. And what happens is we have endogenous cannabinoids in our body, which are anantadine and 2-AG. Anantadine is considered what we call a bliss molecule, and it was anantadine was derived from the Sanskrit word ananda, which means bliss, and it has been known to affect mood, memory, fertility, and appetite. And then we have another endogenous cannabinoid called 2-AG, and that actually, again, is something that circulates in our body. It's the most abundant cannabinoid that we have in our body, and it has been shown to modulate pain, inflammation. And in addition to that, THC resembles, as far as looking at on a molecular level, THC and 2-AG actually have similar structures. And so that is part of the reason why when you introduce phytocannabinoids, which are derived from plants and are seen in the hemp plant as well as the cannabis plant, you could see that it affects it causes the same effect as some of the natural endocannabinoids that we have in our body. There is also a third type of cannabinoid, synthetic cannabinoids that are manufactured by pharmaceutical companies. I think the most popular right now would be Epidiolex, which is a CBD extract, as well as Marinol, which a lot of people are familiar with, which is mostly derived from a THC extract. And so I'd like to just say again, to summarize, we have 3 different types of endocannabinoids available to stimulate the endocannabinoid system, and that's the endocannabinoid systems, which endocannabinoids, which are found in your body, phytocannabinoids, which are derived from plants, and synthetic cannabinoids. And most of the things that we talk about in this particular discussion will be mostly talking about the phytocannabinoids and the synthetic cannabinoids. And so now I'll dwell a little bit about the research. There is a lot of research that is coming out. Most of the studies, again, like I said, are in Israel right now and looking at the benefits of cannabinoids with in conjunction with chemotherapeutic agents or in cancer patients. I would say that it would be a far reach to say that cannabinoids would cure cancer. I think that that's too far, and people who make those statements are kind of on the far left, so to speak. I wouldn't go so far as to say that, but they are showing that there's a significant benefit in the cancer arena with cannabinoids. There was a study done by Barcella. Again, he's an Israeli scientist in 2013, and he looked at 106 patients. It was a prospective observational studies. And so what they did is they took patients that were on opioid therapy to help with cancer-related pain. And a lot of the patients had significant side effects because they had severe pain that was resistant to, that were basically intractable with opioids. And they were also using other adjuvant therapy with antidepressants and neuropathic medicine. So what they did is they introduced a whole plant extract from a dispensary, and they looked at symptoms of patients and seeing if they had some improvement. And 70% of patients were able to see at least a 43% reduction in their pain. About 50% reported that their severe pain had improved. And about 33% of patients were able to reduce their depressants and anxiolytic. One of the cons to the study is that there was a decrease in short-term memory, and this was transient. It's usually seen in the first year of initiation of the cannabis extract, and by that second year it had returned to baseline. There's also Dr. Donald Abrams. He's an anesthesiologist that has done a lot of research in looking at cannabis, specifically in HIV neuropathy and in the chronic pain arena. And as well as Manuel Guzman, who has done some studies with glioblastoma and looking at THC. And they truly believe that using cannabinoids is a part of a multidisciplinary treatment for patients can help to sometimes have dose reductions in medications and help to improve overall side effect and well-being for patients. And here are some of the preclinical trials that are going on now in looking at cannabinoids. And I think this is where a lot of people start talking about cannabis and helping in the turnover rate of tumor cells. And it's because there's done studies to show that the TRPV, the PARs, the PPARs, which are strong receptors that are responsible for the turnover rate of tumor cells. They're showing that cannabinoids are able to block that and sometimes slow metastasis. Again, this is preliminary research. A lot of the studies were done in mice and in animals, and they're now starting to do the studies in human trials. And I just wanted to cite two of the studies that were done that have been completed in human trials. And it was one by Guzman in 2016, where they took THC, a THC CBD extract, and then they looked at a CBD isolate, and they found that the THC was actually more beneficial in decreasing the cell proliferation and the biomarkers for glioblastoma multiforme, which is an aggressive brain tumor. And also GD Pharma, they did a study in looking at Timobar as well as with CBD, a one-to-one concentration of cannabis oil and Timodar, and also looking at Timodar long, which is a chemotherapeutic agent that they use in glioblastoma multiforme. And they found that there was an 83% survival rate with addition of the cannabis extract versus a 53 one-year survival rate with just the chemotherapeutic agent alone. And as far as in the chronic pain arena, which is, I mean, we see every day, chronic pain is an emerging health issues. We deal a lot with patients and making sure that we're able to provide patients with dose reductions. And in addition to that, patients that they're seeing when they initiated, I'd say like in the 1980s, when they initiated the increase in prescription of opioid drugs, they also saw an increase in opioid overdose incidents and driving accidents and things like that. And a lot of times patients have side effects with constipation, decreased sexual function due to the decrease in testosterone levels and things. So it's a lot that goes into the treatment with chronic opioid therapy. And so a lot of clinicians find themselves having to balance the treatment of medication, of cancer-related pain, neuropathic pain, and centralized pain states, which can sometimes be resistance to the use of opioid therapy, and trying to escalate the dosages or find alternative treatments to provide dose reductions for patients. And it's the ABC News report, they did a poll, and they found that about 19% of the adults, that's 38 million people in the US, actually have chronic pain, and about 6% or 12 million of those patients have actually tried cannabis or using cannabis to treat their chronic pain. So there has also been some extensive scientific randomized controlled trials which looked at cannabis extract and effectively treating chronic pain. A lot of people, scientists have researched CBD, and they feel that the overall reason that it is able to provide anti-inflammatory or an immunosuppressive effect is because of its ability to modulate the cytokine and inhibit T cell function, which is a function that you see when your body, when something is introduced to your body like an infection, your body tries to fight it off by using your immune system. And a lot of times some patients may have overreactive immune system, or too many inflammatory mediators released, and they found that CBD can kind of help to modulate that. In addition to that, Ethan Russo, who was a principal investigator with GW Pharma and coming up with the extract Epidiolex, and in the clinical studies, they do find that conditions like fibromyalgia or different other conditions, inflammatory conditions that are resistant to treatment, a lot of times they found that these patients have deficiencies in their endocannabinoids, and that's the anandine and the 2-AG that we discussed earlier. There also was a study that looked at anandine levels in patients with migraines, and they've been found to have a deficiency in their anandine levels. And so they believe that by supplementing with phytocannabinoid or exogenous, introducing cannabinoids into your body, it actually causes an upregulation of the endocannabinoid system and to release neurotransmitters that can kind of be beneficial in some of these disease states. They've also found, there was a study that found that the endocannabinoid system is very active in patients with irritable bowel syndrome and intestinal pain. Again, that's going back to effectiveness with the cytokine system and the inflammatory mediators. And they've been looking at studies and looking at the possible benefit of cannabis in nausea and vomiting. In particular, there's been a lot of study with CBDA, which is a precursor to CBD and THC. You can consider it as the mother. And when it is heated up, CBDA either turns to THC or CBD. And what they found that if CBDA actually is a more potent antiemetic than even THC itself in helping with treatment of nausea and vomiting. Now, from my position, what I try to do is I tried to do a survey. I had product line, and so I basically looked at about 75 people that consistently use the CBD oil on at least 8-week basis, and look at some of the benefits that they had, and looking at some of the reduction in their pain, sleep, and things like that. And to see, again, this is preliminary results, and it's just a survey that was sent out to about 100 people, and about 75 people actually responded that were using my CBD product line. And of those patients, the questions that we asked, the first question was, do you have pain? And if you have it, what is your pain score on a scale of 1 to 10? And about 65% of the people saw a drop, at least a 2-point drop in their pain scores. About 32% of those patients felt that their pain scores actually dropped by 50%, and at about 10% or a small percent of those patients actually eliminated their pain medications. They were able to titrate off their pain medications altogether, which when I get into talking about some of the potential interactions with CBD, it'll explain a little bit about why you would see this, especially in patients that were on opioid therapy. In addition to that, we looked at anxiety and sleep. And often patients with anxiety disorders have a constant preoccupation with worrying and just basically their mind is constantly racing. And about 75% of people saw a reduction in the intensity of that impending doom or nervousness that they felt, and about 24% saw reduced days where they would have a day where they wouldn't even be anxious at all. As far as sleep is concerned, they believe that CBD actually helps to increase REM sleep, which is the deep sleep. You also the best way I can kind of characterize REM sleep is if you've ever had an endoscopy or some type of propofol, or like most people say, the Michael Jackson drug. When I say that, everybody knows what I'm talking about. And what propofol does is it puts you in a deep REM sleep, so you feel like that you've slept for hours and you've maybe only slept for 30 minutes if you had an endoscopy or so. And so they believe that cannabinoids or CBD does the same thing. It helps to increase your REM sleep. So what we looked at in this small survey is to see how many people are able to sleep at night. Did you gain more hours of sleep? And 43% people gained more hours of sleep, and about 18.9% gained more than 2 hours of sleep. And also it helped to decrease the time period with which a person would fall asleep. A lot of people with insomnia may get in the bed and want to go to sleep, but it may take 2 to 3 hours for them to actually get to sleep. And about 30% of the patients had a decrease in their sleep. You can see on here about 30% were able to go to sleep within 30 minutes, 25 in 45 minutes, and 20% within 60 minutes. As far as abdominal pain, again, when you look at, we looked at constipation, nausea, vomiting, bloating, constipation, and the most common symptom that was improved was constipation, and about 20% of people out of those four symptoms were able to eliminate at least one symptom. The decrease in the symptoms by 2 days a week happened in about 27% of patients, and about 20% of the patients of the 75 people that responded to the study were able to eliminate nausea, vomiting, bloating, diarrhea, and constipation altogether. I wanted to also talk about another study that was done with Care by Design. And what they did is they took it in an 8-month span of time. They did a survey in looking at 3,500 people actually responded to the survey. And what they were looking at is to figure out, to kind of look at the epidemiology of CBD and see who's using it, what type of products that they are using, and is the CBD actually working for them. And in the study with pain and mood, they found that these were I shouldn't say study, in the survey, pain and mood were the most common improvements that patients had in the survey. And about 90% of the responders reported that they have an improvement in their anxiety to some degree. About 68% of them had a significant improvement in the nervousness to a moderate degree. And about 3% of patients felt that it actually worsened their ability to concentrate. Because if you look at one of the side effects of CBD, especially if you take too large of a dose, you can get a little bit of fatigue. As far as improvement with pain, about 90% of the participants reported some improvement in the frequency of their pain, so they don't get as much breakthrough pain. About 60% of them reported that their pain was actually better, and they saw actually a reduction in pain scores. Average pain scores were about 6.85% in patients prior to initiating a CBD oil itself, and about 2.76 once they did start CBD on a consistent basis for at least about, I think, 8 to 10 weeks. And so now I would like to talk a little bit about product selection, because not all CBD products are created equal. The products are not FDA regulated by the FDA, so there can be a lot of variability in how the products are made. I mean, how the plants are grown, how the products are extracted, and how I guess the benefits that you could see from that. And so it's very, very important for you to understand the differences between the type of extracts that are out there. Now, prior to 2018, a lot of the products that on the market were isolates. And the reason why is because, again, it was considered, anything containing THC was considered a controlled substance. And so with that being said, a lot of the people that did come out with CBD extracts initially were only using isolates because they were trying to eliminate the THC. And in doing so, they would not, be in, I guess, be in jeopardy with law enforcement. And so because of that, a lot of people may not have gotten as much benefit for CBD if they tried it, or have gotten zero results because they were using a CBD isolate. And so you have to be very careful in knowing the difference between full spectrum, broad spectrum, and isolates, which we'll talk about later on. In addition to that, in looking at the safety of CBD, they did studies in looking at they did healthy volunteers and taking CBD in certain dosages from the 300, 400, and up to 1,500 milligrams a day. And they basically noted that the side effect profile in these patients was very minimal. Most of the times, people that did develop side effects to the CBD, it was headaches from taking too large of a dose, or sometimes fatigue if you take too large of a dose. In addition to that, CBD does inhibit the cytochrome P450 system. And what that means is that CBD competes with other drugs for metabolism. So if you are on prescription medications, it's very, very important that you have a conversation with your doctor regarding using CBD products and understanding what could happen once you start initiating CBD. For instance, they started to notice when a lot of people were using CBD and they were having problems with GI bleeds with patients on Coumadin. And it's because CBD competitively inhibits the metabolism of Coumadin. So the Coumadin stays in your system longer. And so therefore your therapeutic levels or the bleeding risk of bleeding could be higher. So what should have happened was that the patient should have had a conversation with their doctor and had their Coumadin dosages titrated down. And so therefore you would kind of put your INR back in a therapeutic level. In addition to that, if you've ever been told that you can't take grapefruit juice, which is a lot of times in patients that are taking antiarrhythmics, which is a class of drugs for if you have heart arrhythmias, then you should not take CBD, because grapefruit and CBD actually have the same type of interaction with specific medications. And so, again, potential interactions, it inhibits the cytochrome P450 in the arena of pain. What does that look like? And what happens is when you inhibit the metabolism, CBD actually inhibits the metabolism of pain medications. Therefore, the pain medications usually stay in your system long. This could be a benefit because it can actually lead to dose reductions of your opioids. And so, therefore, to be honest, that's what I've kind of seen in clinical practice when patients initiate CBD and they're taking it consistently and they are able to respond to it. They're able to see dose reductions in their pain medications. In the arena of oncology, it can be very important because, again, by inhibiting the metabolism of drugs, you don't have to use as much drug to be effective. And so there were some studies that looked at bone marrow transplant patients that were using tacrolimus, and they started to notice that they developed tacrolimus toxicity because the patients weren't telling their physicians that they were using CBD oil. And once they figured out they were using CBD oil, they were actually able to lower the dosages of the tacrolimus, and the patients had less side effects to the chemotherapeutic medication. So it can be a win-win, but you have to, like I said, it's very important for you to let your physician know what you're doing and what you're taking. And we already spoke about, I touched about Coumadin and making sure that you're able to adjust those dosages. We've seen it more with Coumadin, but I haven't really seen it with a lot of the other anticoagulants like Eliquis and things like that. But what I always tell patients to do when they want to initiate CBD oil is to also speak with the neurologist, especially if you're on epileptic drugs, because again, it could cause those levels to raise. And also speaking to your cardiologist or oncologist, hemoncologist, if you're being prescribed a blood thinner, to make sure if there's dose reductions or if they can do any markers to determine what your levels are of the drugs and titrate down on the drugs if possible. Most of the common side effects that usually the general side effects that are associated with CBD, again, is that it can be too relaxing, which can be a positive thing, especially if you're taking it for insomnia or if you're having problems with anxiety. If you take too large of a dose, it can cause hypoglycemia, especially in diabetics, because again, it inhibits the metabolism of medicine. So you may need to have a dose reduction in your medication as a result of that. There are patients that it just doesn't work. I mean, they've been on it for 8 weeks. They're taking it consistently. A lot of times I make sure if the patient says that it does not work, I make sure that it's not an isolate. So I like to look at the certificate of authenticity, which we'll show later, to make sure that it's not an isolate and that it's a full spectrum product. And if that's the case, they may not have a deficiency in their endocannabinoids and CBD won't work for them. In addition, if you take too large of a dose, then you can develop a headache. But one of the most common complaints, especially when you're dealing with a full spectrum whole plant extract, is that CBD has a earthy acquired taste. It's kind of like beer tastes like corn chips to me, and it's an acquired taste. It's the same thing with CBD. It has a very earthy taste to it, and some patients can tolerate it, some patients cannot. I tell patients, if you can't tolerate the taste, a lot of times if you put the drops in honey, it can provide a better taste profile for you. And also honey kind of helps with allergies, so that's kind of a dual benefit. But again, that's kind of the major things that you see, that I've seen in patients or clients. Again, this, I don't want to, for the sake of time, I don't want to kind of get into too much of the dosages. I put this up here because I feel that it could be beneficial for people who are trying to initiate CBD oil and to look at what dose range to start with. I will say that a lot of times the products on the market are telling you to take a whole dropper. But if you look at the surface area and understand absorption as far as CBD oil goes, you're going from oil to water. Your body is water. The CBD oils are usually in carrier oils. So if you take the larger amount that you take, the less likely it will be to be absorbed. The bioavailability of CBD oil itself is about 40 to 50%. But there's certain things that you can do to optimize that. One of the things that you can use to optimize that is to use it in combination with black pepper extract. Also to take it after a meal, because fat helps to absorb the CBD more in the body. And in addition to that, taking it up underneath the tongue and doing what we call microdosing. And that means divide the dosage up into 3 times a day. And by doing that, those type of things, it can help to increase absorption and bioavailability of CBD in your body. And if you have questions about what you should take, how much you can take, I can dwell more into that later. But I'm going to kind of move on for the sake of time. Now, in looking at the type of CBD products that are on the market, I put this slide up here because it will help you to understand the difference. So when CBD oil is extracted, you're taking the oily resins off of the plant. And in doing so, you're extrapolating not only CBD, but there are, again, 113 other cannabinoids that are found in different plants and the genetics. If you understand the genetics of the plant, there's certain cannabinoids that are more dominant in certain plants, and flavonoids and the other cannabinoids, which I'll talk about in the next slide, are also just as essential as CBD and THC in creating an entourage effect. And what I tell patients is it's kind of like the complement of these other cannabinoids are like having a meal with seasoning and a meal without seasoning. Having a meal without seasoning will provide you the nutrients that you need, and it can get the job done. But boy, does that seasoning taste good, and it adds more of an overall better experience to the meal. And that's the same thing with the different flavonoids and other minor cannabinoids that are found in CBD oil. It helps to provide more of an entourage effect. Whole plant extract preserves the most terpenes and cannabinoids as possible. However, it has the nastiest taste. Broad spectrum CBD oil, what that does is it tries to preserve some of the terpenes and the cannabinoids, because each of these cannabinoids and terpenes have a certain boiling point. So when you're extrapolating them, you can, especially like CBDA, which, like I said, is potent for nausea and vomiting. It is one of the hardest cannabinoids to preserve because it's so volatile. So when they're extrapolating it, you're trying to do it at low pressure and as low as temperature as possible to hopefully maintain some of the cannabinoids and terpenes, because this is what's beneficial to the body. And so in broad spectrum oil, they develop broad spectrum oil because there's a subset of patients that are drug tested. So they can't have THC in their system, but yet they want the benefits from the other cannabinoids and terpenes because the isolates weren't working as well for them. And so that's where broad spectrum, where it tries to preserve some of the beneficial cannabinoids like CBDV as well as CBDG. And then you have the isolate CBD oil, again, like before between 2014 and I'd say 16 or 17, this was more of the common CBD oil product that was on the market, and it's free of THC. And usually patients with chronic pain and patients that are trying to help alleviate cancer-related symptoms, they need that THC to help, especially with MS, the spasticity and nausea with THC. And so by extrapolating that out, they don't see as much benefit with the isolate. And again, fresh pressed orange juice versus Tropicana orange juice. They're both good orange juices, but you can tell the difference in fresh pressed orange juice. And that's the same thing as the difference between whole plant extract and a CBD isolate. And in looking at full spectrum isolate, most full spectrum isolates will be able to preserve some of the fatty acids, the vitamin E, and the natural terpenes. And what I wanted to look at is 3 of the minor cannabinoids that are also found that provide a synergistic effect. And on a receptor level, effect like CBC is a potent anti-inflammatory in itself when it's isolated, and it helps, it works on the TRPV receptors and the TRPA receptors, and both of these receptors have been linked to a person's perception of pain. CBG is actually another minor cannabinoid that is found in the hemp plant that it's not that has been studied to block serotonin receptors, and it has been implicated in helping with anxiety and depression. And it's also a cannabinoid that I had a strong interest with because it also helped with lowering intraocular pressures, which I was found to be beneficial with my son. CBN is very interesting because it is found in aged hemp plants or cannabis. That's when, and so you deal with decarboxylation carboxylation, and CBN is a byproduct. And so a lot of people saw CBN as waste until they started studying it. And it actually was, they did a study in looking at diazepam or Valium and CBN, and they found that it was a very powerful sedative and is beneficial in patients that were having problems with anxiety and insomnia. Now, as far as product selection, what I tell patients is the oil is only as good as the hemp plant or the cannabis plant that it was extracted from. Plant genetics are important, but a lot of people, because they may not understand the science, is looking at a lot of the products on the market are mass. They grow the hemp plant, they extrapolate it. They're not necessarily looking at plant genetics closely as far as disease states are concerned. And then they're bottling and shipping it out. So it's very important for you that when you're trying to select CBD products is to look for the certificate of authenticity. And what that does is it's going to give you the blueprint, or I can even tell the genetic of the plant based upon the certificate of authenticity. In addition to that, it's very important that you discuss the products with your primary care physician before starting any new medication. And the reason why is those drug-drug interactions that I spoke about earlier. One that I did not touch on is anti-lipid drugs like Lipitor. And what happens is, again, CBD inhibits the metabolism of the medicine, so the Lipitor will stay in your system longer. Lipitor, even if you weren't taking CBD, 2 to 3 years down the road, you can develop leg cramps. But they found that some patients develop leg cramps quicker when they initiate CBD oil. And all it requires is to have a conversation with your primary care physician and switch you to something like Pharmacology, which is less likely, which doesn't interact on the same metabolism system as CBD, and the leg cramps go away. So that's just another reason why it's very, very important for you to have the conversation with your physician with initiation of CBD oil. And in addition for that, to make sure that the physician understands what we may need to adjust medications and things like that. And in addition to that, if you are concerned or have questions about a product, always call up and ask the company to see whatever information you need. How's it extrapolated? Are they getting it from an organic form? Things like that, you can always call up and ask. And we'll talk a little bit more about credible sources later on. Now, this is a COA from a product that I've actually formulated, but I wanted to show it to you because I want you to be able to look at it and see so you can understand what is the difference between full spectrum and isolate. So if this were an isolate product, what you would only see is CBD only. So isolates are usually 99% pure. So they're basically taking CBD powder and mixing it in a carrier oil, most of the times fractionated coconut oil. And so you would only see CBD. But in this one, it's full spectrum because not only do you see CBD, but you also see some of the CBG, you see CBD, and so you see some of the active other minor cannabinoids. In addition to that, you see delta THC9 or THC. And that is how you will able to determine whether this is a full spectrum product. And also there is important things that are in it also called terpenes. And I don't want to get, I could have a whole lecture on terpenes in themselves, but there's certain terpenes that are found in CBD products that also provide a synergistic effect. For example, myrcene actually helps to cross the blood-brain barrier. Limonene is a great anti-inflammatory, and beta-caryophyllene is also a great anti-inflammatory. So if you look at this particular COA, the inflammatory, the caryophyllene, as well as the limonene is actually beneficial, and the myrcene helps to kind of help it to cross the blood-brain barrier and interact and provide inflammation, basically. Now, my thoughts on public safety are this. It's very, very important for you to make sure that the CBD oils are tested for pesticides, organophosphates, making sure that it is derived from an organic form, or a form that uses organic practices, because the plant itself absorbs everything around it in the dirt. A lot of times they use it's a weed, basically. That's how they came up with the name weed, because it absorbs everything in its environment. And if you have a lot of heavy metal, and you have a lot of if you're using pesticides and things like that, that's going to be absorbed in the plant, and that translates to being put in the oil. And so it's important for them to test against that. Again, if making sure that you're able to get COAs or lab results, or that they're third party testing it. A lot of times manufacturers provide companies with the CBD oil and the COAs, the certificates of authenticity. But I also think that it's very important. It's expensive to do the testing, but it's very important for the company to do a third-party testing to make sure that the company that's manufacturing or extrapolating the oil that they are giving you actually makes sure that it has what they say that it has in it. There is variability in the amount of CBD oil that's in each bottle. It could be plus or minus 10%, just because of the way the oil is extrapolated. It's not evenly distributed. So when it's being bottled, a lot of times you may only have 499 of actually CBD in the bottle, but it also has other terpenes in a bottle that can bring it up to maybe up to 724. This is the total cannabinoid in this COA to show you, but this is a 500 milligram bottle, but it only has 499.38 CBD in the bottle. And that just is an example of how there is variability in the amount of CBD that's actually in the bottle, but your total cannabinoids can sometimes be over, but those extra cannabinoids are what provides the synergistic effect. In addition, I think more research is needed in looking and exploring the different conditions that CBD is able to provide, especially in the U.S. There are a lot of studies in Europe and Israel, but it would be helpful to have some studies in the U.S. to substantiate some of the things that we're seeing anecdotally. In addition, knowing the difference between hemp extract, hemp seed oil, as well as full spectrum oil, making sure it's labeled appropriately and the amount of dosaging. I like to follow what the guidelines from the cosmetics industries, or what is being labeled in the food and drug industry. Even though it's not regulated by the food and drug industry, I believe that anyone that's actually providing CBD oil to patients should follow good manufacturing practices and follow certain guidelines and the standards of the FDA, even though they're not at this point being held by the FDA, but it will be coming down the pipeline soon. And so these are some of the research articles. It's really a lot of research articles that I could have cited and quoted, and I can provide more information if need be, but I kind of want to keep it simple. But that's pretty much it. So now we're open to questions. I'm open to see what people have to say and what questions you have. Thank you.
Thank you, Dr. Reese. That was a really interesting presentation. I think especially focusing on the different kind of CBD oils out there and making sure the ones that people are getting are legitimate. And we're going to open up the chat box if anybody has any questions. I do have a couple, and I think this is something you kind of touched on earlier. Since CBD oil is over the counter, is it important that I talk to my oncologist about starting it, or is it something I should seek the advice of a pain specialist?
Well, I think both, to be honest with you. I believe that when you initiate any type of regimen, it's very important for you to have contact with the oncologist as well as the pain management specialist, especially if they have referred you to us for pain management. And the reason why is because CBD does interfere with the cytochrome P450, and the oncologists are already juggling so many different side effects associated with the chemotherapeutic drugs that they're dealing with now. it is very, very important that they know that you're taking it. It's kind of like the study that I talked about earlier about with tacrolimus toxicity in patients that were taking CBD oil and weren't talking to their oncologist about it. And then once they recognized that that was the inhibition that was happening, they were able to lower the amount of tacrolimus that they needed to prevent that graft versus host disease, and it minimized side effects. So I think a lot of times patients are scared to talk with their provider about it, but in actuality, it can be beneficial and used as a tool for providers to have dose reductions in their medications. And that's kind of what we use in the pain management world to help to have dose reductions. NSAIDs is another thing that's really beneficial. Patients that can't take NSAIDs because of GI ulcerations or because of kidney issues. There's nephrologists that send me people to put on CBD oil because it helps to it's an alternative to help with their joint pain or inflammation, and it doesn't affect their kidneys. So I think it's very, very important to have like a team approach when it comes to initiating treatment with CBD oil. And it's also very important to find providers that understand the pharmacology of it and understand how CBD oil works, and provide, and so they can have kind of like a fluid discussion from provider to make sure that we provide the best outcome for the patient.
Mm-hmm. And kind of tacking on to that comment, if someone is looking for some CBD management for something like inflammation, how do they know if they should take something orally or topically?
Mm-hmm. So in looking at the difference between the two, I usually tell patients, if you have a targeted pain, like knee pain, shoulder pain, I'll give you, for example, my mom. She was in the chair. She uses the cream, this topical cream that I formulated for her knees. And she only has problems with knee pain and sometimes in her neck and shoulder. So if you have occasional pain, that's more so topical application that I would use. If you're having systemic pain, like from rheumatoid arthritis or from osteoarthritis, and it's throughout your body, it is multiple locations, then I would consider taking something like an oral tincture. You can always supplement with the cream for, say, intermittent pain and things like that, but I would start with a oral tincture. There have been people that are able to use just the creams topically and get benefits systemically, but those are usually patients that are really, really sensitive to medications in general.
Okay, and we had one participant share an experience I wonder if you could comment on. I was told not to take CBD within 2 days before and after because it lessens the effect of the chemo. Do you have any experience with this?
What they're talking about is they want to make sure that CBD is fully washed out of their system. And it could be, again, related to the metabolism of or the CBD's interaction with the cytochrome P450 system. And so I would have to see what things that the oncologist, what chemotherapeutic drug they were speaking of. And in addition to that, usually we recommend 2 hours in between the use of medications if you're trying to prevent any drug interaction. Not 2 days, it's usually 2 hours, but maybe they're just trying to be safe and use a 2-day washout period instead of using the 2 hour.
Mm-hmm.
For
Okay.
most patients within 2 hours, it's usually fine, but it's like 4 to 6 hours with because again it's being metabolized so quickly, so it's usually like, I'd say, I'm sorry, 24 hours where it's completely out of your system, not 4 to 6.
Okay. And another question, do you know if any insurance companies cover any CBD oils?
That is a hot topic. And that is, I do believe that they're coming towards that. But the problem is that CBD, the cannabis oil and CBD oil has such a stigma. A lot of lawmakers, when you bring up the subject of hemp and cannabis, kind of shun it because it's such a controversial topic. So I do think once they see more research and studies that support that you see a dose reduction, a decrease in prescription drug costs, they'll be more likely to want to have it covered. I want to say that you can, if you have an HSA account, you can get it. You can pay for it that way, but that's further down the line, and I don't see that coming anytime soon. I actually have know a couple of people that actually work with Medicare and the guidelines and things like that, and they have had presentations, but they basically say a lot of people aren't on board with it yet from in the policymaker arena, and so that's the reason why it hasn't been covered yet.
Okay, but that's good to know to maybe look into your HSA or FSA to see if it would cover it. Another question that came through is, what do you think about nanotechnology combined with CBD oil to improve bioavailability to 99%?
Well, in looking at the nanotechnology, I did, because they use a lot of nanotechnology when they're using, especially for waters, they're making supplements with water and things like that. And there's pros and cons. They say that it increases the bioavailability, and there are a group of people that love nanotechnology and using it, but it also, there's a subset of people, by using that nanotechnology, you're actually breaking up the structure of the plant. And so you may be losing, while you're gaining benefit in bioavailability with CBD, you're losing also some of those beneficial terpenes and other cannabinoids. So there are people that are strong proponents of nanotechnology. And what they mean by nanotechnology, they mean that the CBD is put in micelles and it helps to increase the absorption in the body. And you can correct me if I'm wrong, the person that's asking the question. And so it actually makes the CBD more bioavailability in the body. But at the same time, you're sacrificing some of the beneficial terpenes and cannabinoids. So that's my take on it.
Okay. And is there a reference list of credible companies to buy from, since the FDA is not currently managing this?
Yes. So I say this with hesitation because I think the best rule of thumb is to look at the certificate of authenticity and look at the culture of the company. Read about the company and what they're doing and why they started. And I think that would help you to see if someone's heart is truly in it to provide quality products to you, or if they're in it for the money. That's my first comment on that. And I would say I personally formulate a product line. It's called Pure Therapy MD, and you can go to puretherapymd.com. And I formulate products. We look at the organic farm extrapolation. We look at it from seed to sale. CW Hemp is also another great company that provides quality products that I personally trust and that I think are doing a very, very great job. And Ananda Professionals, I would say, would be another company that I think is doing a great job in providing quality CBD products. Lazarus Oil is also another one that I would consider purchasing CBD products from.
And when you purchase the CBD product, does the certificate of authenticity automatically come with it, or is it something you need to follow up with?
It's something usually you can follow up with. A lot of times in companies, they post them online, but sometimes they have kind of come out of favor of doing that because, like I said, the plants actually show the genetics or the DNA of the plants. And a lot of times companies can kind of mimic what you're doing if they're able to see the certificate of authenticity, especially if they're smart. And so a lot of times all you have to do is ask or request a copy of the certificate of authenticity. And again, some people are getting it from their manufacturer, but a lot of companies are also doing a third-party testing, and so they're able to provide that to you readily if you need it.
Okay, great.
And if they don't, then I wouldn't buy it from them. And I would caution you from buying it off Amazon and out of the gas station.
It's a good rule of thumb. Okay, and we had one participant share an experience maybe you can help her with. She tried speaking to her primary physician about using CBD oil to address her pain, and it sounded like maybe the physician was not necessarily addressing that concern. Is there a place she should go to next or someone she could follow up with?
Well, you can follow up with me. I would be happy to help you. But I will tell you that the problem, and this is something that we're trying to, at least I'm trying to work on, is that a lot of times in medicine, and I am guilty of this myself, when you don't know something, you tend to say no. And that's what we see a lot of times in this arena, because CBD oil kind of gained favor and traction before the medicine community could catch up with it and understand the benefits of CBD oil and cannabinoids. And so because of that, a lot of times you get shut down by your primary care physician or by your provider because they don't understand what it does. And they're like, okay, that may be just a fluke. And again, this is a plant that was illegal and still on a federal level, cannabis is illegal, even though they're allowing states to govern and actually have medicinal programs. On a federal level, anything above 0.3% is illegal. CBD just became legal in December 2018. So a lot of providers don't understand the benefit, and the only way that they know is they see anecdotally through you. So if you're interested in starting it, I think that's the reason why I kind of learned a lot about it and wanted to be have extensive knowledge in it, because I think there needs to be a safe place. When I was on the journey with my son, I didn't have a safe place. So I had to do the research myself and understand the benefits. And I was kind of embarrassed because I was like, okay, people are going to think I'm crazy if I tell them what I'm doing. But it was beneficial and it helped and it changed the direction of his treatment. And so you're your best advocate. And if you can't find what you need with your provider, I'll be happy to help you to figure out what you need and the benefits and titration. And then you can have a fruitful discussion with your provider if need be as well.
Okay. So it sounds like you're the first place to start and maybe following up with their provider.
Mm-hmm.
And then we have another question. This is from a participant, her experience. I have bladder cancer. I've been taking CBD since diagnosis. How much CBD should I be taking daily? And also, what's the best method of taking it? And then she also asks, I have done tinctric, but also capsules that have powdered in a capsule. So I think the capsule goes directly to my urinary system versus under the tongue. Do you have any thoughts about that?
Yes, I have thoughts about that. So capsules actually are 4 to 20% bioavailable. And the reason why that's the case is because, okay, let me go back. So as far as the dosage, it depends on what you're using it for and what symptoms. If you're taking it for anxiety, sleep issues, I would say about 5 to maybe 20 milligrams is all you need in divided dosage on a daily basis. If you're taking it for chronic pain, 40 to 50. If you're taking it for pain and cancer-related symptoms, 50 to 100 milligrams in divided dosages. There is no exact amount that you can take. It's not like it's a monopharmaceutical that you find like with metoprolol, you take 5 milligrams or 10 milligrams of metoprolol. It's not like that. With CBD, less is more. And in addition to that, you have to titrate it up and find your sweet spot and stay there. So that's kind of a loaded question. As far as the difference in taking a tincture and a capsule, I definitely see that if you're going to use a capsule, I wouldn't use a powder capsule. I'd use an oil capsule if possible, if you can use it, like a gel cap, liquid gel, if possible. But also that capsule is being absorbed in the stomach, which is also in a lot of gastric juices. And I've already said earlier, when you're extrapolating CBD, you're fighting against pressure and temperature in order to maintain cannabinoids. when you're putting it in an acidic condition, you're going to lose some of your cannabinoids. That's why it's only 4 to 20% bioavailability, versus if you use a tincture and you're putting it up underneath your tongue, all you have to worry about at that point is going from oil to water. So therefore you take a higher concentration and you use, and so that's why I believe in microdosing, and so it's less amount of oil that has to be absorbed in the body. Does that make sense? I hope it makes sense.
It does, yeah, thank you. And then one participant asks, what's your experience with CBD and immunotherapy? If CBD decreases the inflammatory process, with immunotherapy, we're hoping to get an inflammatory response. Does this work against one another?
I would say yes. Because CBD is a immunomodulator, meaning that it's trying to suppress the inflammatory response. So if you're trying to boost your if you're trying to boost your immune response, it may not be the best. I wanted to ask, is she talking about a bone marrow or what immunotherapy in what context, I should ask?
It doesn't say specifically. She's responding with Keytruda. I'm not sure if that answers your question, though.
I will say this. When in order to suppress the immune system, shut it completely down, there's not necessarily shut it down, but to get a significant immunosuppression, you have to be taking larger doses. The studies that show those immunosuppression are 500, 600, 1,500 milligrams a day. A lot of times people are taking a bottle over a month period of time of a 500 milligram bottle, or even a 1,500 milligram bottle over a period of time. So when I'm thinking about when I conceptualize using CBD in the cancer arena, is to help with side effects. And in addition to that, with Keytruda or any immunosuppressive medicine, it's going to make it stay in your system longer because of the competitive inhibition for metabolism. So it will provide more of a synergistic effect than basically completely suppressing the immune system.
Okay. And then this question is, can regular use help prevent any of the conditions that CBD oil can help treat?
You're talking about preventing arthritis and things like that?
I think maybe taking it proactively.
I wouldn't take it proactively. If you don't have any, again, the reason that you're supplementing with CBD oil is because you have a deficiency. If you don't have an endocannabinoid deficiency, it's not going to be beneficial. So there's no really reason to take it. Oh, my daughter's trying to come in. Sorry, guys.
I think that might be it for the questions. People are asking how to get in contact with you. Aw. Should they go through Northside Spine and Pain Specialist? And we're getting a lot of thanks.
Yes, thank you.
Thank you very much, please, Dr. Reese.
Yes, please see me at Northside Spine and Pain Specialist, and I'd be happy to see you. And also, again, you can check out my product line at puretherapymd.com.
And I do want to also mention, if you're interested in other oncology support services, please visit our website, cscatlanta.org. We have a lot of free support services for those affected by cancer, including support groups, stress reduction classes, and education programs like these. So thank you again, Dr. Reese. This has been helpful and enlightening, and we appreciate you.
Thank you. Bye-bye. Good luck.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.